Hello guys. Hi. I hope mko poa. My name is Cecilia Moshogia, your host. It's a good morning. It's a lovely morning. So leo nimeamua to talk about a topic yenye it's affecting everyone, but people are not really talking so much about it, and ni kuhusu contraceptives. So contraceptives who affect sana watu. I mean, initwaje, not choosing them, they do affect people a lot, but people wanaweza kosa kunotice. So today imebidi nitafute a nurse. Actually, she's been on the podcast again. Her name is Kadesa. She's doing nursing in MKU, and I'm going to let her introduce herself.
Yeah, good morning. My name is Kadesa Michelle, and I am a student in Mount Kenya University studying a Bachelor's of Science in Nursing. And I'm hoping that the information that we will give you today will be beneficial to a lot of you guys, adolescents, men and women all over the world. I'm hoping that I trust myself enough to give you the right information based on the syllabus and the curriculum. I hope this matches the Kenyan nursing program. Please, if anyone is listening to this, or to our NCK, I'm representing you guys. And if any information whatsoever that I give is perhaps not aligning with whatever that you guys know, you are free to do research on that. Thank you.
Yeah, so guys, as amesema, I hope na vile nini chaje vile unajua as an individual, please do take the information seriously, but at the same time do your own research. Any research yetu. So pia wewe do your own research and investigate further on what we're going to tell you about. So the reason why I wanted to do this episode leo, first of all, nimekam ku realize like the rate of abortion in people, especially in age yenye tuko, it's really high. So I did a research. I had to like go through this thing na nika realize that out of 1,000 people, 48 of those people between the age of 15 to 49, they do carry out abortions.
Oh my God.
Yeah. Inaitwaje, kuna unsafe abortions zenye they lead to mobility, and the other thing yenye ulikuwa umeniambia morbidity.
Yeah.
So Kadesa is going to fafanua to us what is morbidity kwanza, and pia mortality for the people who don't know. Pia on the other hand, before she says, she explains to us, people like the age of 17 sana sana they wanakwanga ashapoteza their virginity. So tell me, by the time that between the age of 17 and ukwe maybe married or something, there between maybe you've had sex but you're not protecting yourself, na hiyo ndo tunataka kushughulikia leo. So Kadesa, for the first part, what is morbidity and mortality?
Okay. So morbidity is just basically the condition of suffering from a certain disease or a medical condition. I think I don't know if it's self-explanatory, but that's what. Okay, it's basically just the state of being unhealthy from a particular disease or a certain situation. But mortality is the number of deaths that can occur in a certain population.
Okay.
Yeah.
So guys, we're going to dive into it mara moja, and the first thing I'm going to ask her, please explain to us family planning ni nini na pia contraceptives, what are they?
Okay, so basically I'm finna start with contraceptives. These are methods and devices that are used in order to prevent certain pregnancies. And that normally works hand in hand with family planning, because family planning is basically just the process where both the husband and the wife, or maybe a couple that is prepared to have kids, discuss and mutually decide how many children they would like to have and when. So the goal of family planning is normally to give sufficient love, attention and care and good education to your kids, because once they're spaced, you'll have time to prepare yourself financially, psychologically, and everything that is needed. And the family planning services are normally offered to individuals of childbearing age to determine the number and the spacing of your children, and also to reduce the incidence of maternal and infant mortality.
Okay, I love that. Na napenda that nini nitaje the family planning thing, it's for people who have decided to live together.
Yeah.
But you realize that people are having sex from maybe the age of 17 or maybe even earlier than that. So these people are adolescents. Definitely most adolescents have no plan to get married at that age. So what affects like nini hufanya adolescents mostly wasiende kuseek help from hospitals?
Okay, so there are various barriers to contraceptive access when it comes to adolescents. Some of them are provider biasness. The people that are providing the family planning services tend to be a bit biased towards adolescents because, they have the traditional mindset that only married couples are the ones that are supposed to have children and everything. So when an adolescent perhaps goes to seek help from them, they're like, what are you doing here? You're too young for this. They don't want to help you. That's a very serious barrier. The other one is confidentiality and privacy. I don't think most adolescents are normally open to sharing whatever is going on in their lives, or rather, if they're sexually active too, the family planning services provider. Because nikikuja kwako and I'm wanting to seek help and everything, it will just, I don't know, maybe create a picture in your head, and it's just basically fear of judgment. That's why we prefer to be a bit confidential with our love lives. There are the other one is reduced contraceptive options. We will discuss the contraceptive options, and you will see that most of them normally have a bit of disadvantages that perhaps are a bit scary once you come to think about it. So the options are a bit reduced. We have financial barriers, comrade manze. Yani we hadi mia lunch hatuna, and then you're telling us to go and buy a contraceptive. How? So financial barriers are very crucial when it comes to the access to family planning services. And we also have gender norms. This belief that family planning and contraception is only supposed to be followed up by women. Men wanataka kujitenga kiasi when it comes to that. Of course, not all men, some of them normally have that mindset, and that is actually one of the barriers to the adolescent contraceptive access.
Okay, wow. So guys, mmesikia. I love the one on nini naitaje comrade bana. But you should still consider, and if it's possible for you to save up and do this thing nini naitaje to secure your life and or prevent, because I know like you can't be 22 and planning to get married. I mean to have kids saizi. Most of the times you're not planning to have kids. You have nini naitaje your whole life planned out. Maybe you want to kwanza kushughulikia masomo yako or something. So this is for you. Na pia maybe you're married on the other hand, na you're like staki upata another child or something. So this is also for you. So for the first one, we're going to discuss the least effective method, na hiyo ni natural methods. So for natural methods, kuna method number 1, kuna safe days, na pia kuna withdrawing. So for safe days, basically you follow up, una mark dates zako, kuna siku zenye unanyesha, so you check that out, na una plan pia wakati when you know date yenye unanyesha utajua time yenye maybe you're ovulating. So with that una plan out, so the days zenye unapata kuna days zenye uko safe, yani like if you have sex on those days hata kama it's unprotected, getting pregnant ni kidogo sana. So for that one ni the least effective, because first of all you're at risk of getting sick very fast, getting STIs, getting HIV, and even getting pregnant, because you're just risking this zako. Na pia withdrawing, it's like literally the same thing. Basically I won't explain what withdrawing is, but it's also a big risk, because kuna vitu kama precum which can affect you, because mnaweza sema mna withdraw, but what if the precum has sperms, because it does have sperms. So inaweza pia kumess. So for the safe days, I would recommend an app called Flow App. Your app, at least it calculates your days vizuri sana, so it would really help. Na pia ina nini ingine itoaje, there is more information if you go to premium. Inakupeanga more information on how to protect yourself even when you're having unprotected sex. Na pia inaongezea tu basically a lot of information to it. So I would suggest Flow Up. It's going to really help you. So we're just going to move from that, and we're going to go to the next contraceptive option that you have. Na hiyo ni emergency pill contraceptives.
Okay, the emergency pill contraceptive, commonly known as P2 to everyone. This is used where the women who've had unprotected sex basically just want to prevent potential pregnancy. It is mostly used during the adolescent stage and also in most post-rape cases, because we're trying to prevent the pregnancy for the rape the rape case. Normally, it is recommended about 120 hours after sexual interaction. That's when the health service providers, are most viable to give it out. So we have some certain importances of the emergency pill. It does provide a chance of pregnancy prevention after sex. It is also a very crucial element in the adolescent program. It has to be incorporated more in the adolescent program, because adolescents, the rate of having sex has increased. So it is a very crucial element in that. It is also very vital in post-rape cases and care, as I have mentioned earlier. However, it should not be used as a regular method, because, as we've said, it is recommended 120 hours after sexual interaction. So you're not just supposed to take P2 every single time and every other day. Yeah.
Okay, Pia, if you've heard, and I'm sure most people have heard, that if you do take P2, like I don't know how many times in a year, it's going to affect you. So do take care with that. Yeah. So that's why, like, ndo tumeweka the second list in effective method. So we're going to go to the third one in barrier methods. So there is condoms, kuna cervical caps, na kuna diaphragms. So for the cervical cap, basically a small cap made of silicone that fits in over the cervix. Like, okay, I don't know much about cervical caps, but basically ni kama unaweka kwa cervix yako tu basically. And it's least effective, especially if you've given birth. Itakusumbua kiasi. So the condoms one. Let's talk about the condoms.
Oh, the condoms, huh? So basically, barrier methods, condoms is one of the barrier methods. They work by creating a certain barrier between the vagina and the man's penis, and also the cervix and the anus, therefore preventing the sperm from reaching and fertilizing the egg in the fallopian tube. So basically, that's why they're called the barrier method. It's just a wall, basically, between the two reproductive organs, preventing interaction between the sperm and the egg. Yeah, and the condom is one of them.
Okay, the reason why we are laughing is because before the episode I was telling Kadesa, Kadesa calls, instead of saying penis, she says penis. Ona there's so many effects in it. Instead of saying penis, she says penis, and I was like, what?
I'm sorry. It's not me. It's my
anyway. Inaitwaje hapo mtatusaidia. Is it penis or penis? Like, help us out, please. Comments. Yeah. So for the third one, for the fourth one, we're going to discuss hormonal methods. Tueleze, please.
Hormonal contraceptives, my very much favorite. Okay, so the contraceptives normally contain synthetic hormones. Synthetic just means they've been, sorry? Oh, the two types, yes, I'm getting to that. Yeah, they contain synthetic hormones, either estrogen, progesterone, or a combination of the two, whose primary mechanism of action is basically how they work, is prevention of ovulation, or rather it causes the cervix to produce a thick mucus, making sperms impossible to penetrate through. So you should be very careful when you're using these methods because they do not they do not protect one from STIs or rather HIV. And a woman that is using these methods should supplement them with barrier methods, zenye tumesema tu sahi akina condom, in order to protect yourself from the diseases. Yeah, so there are two types. We have the combined oral contraceptive and the progesterone only pills. Combined oral contraceptives, commonly known as the COCs, they contain estrogen and progesterone. Now, estrogen and progesterone, for those who are not aware, are just basically hormones that are function in mostly the female's body, but they're involved with pregnancy, they are involved in puberty, they're involved in menstruation, sex drive, and also sperm production, which means that they are also contained in the male body in some quantity. So for the combined oral contraceptives, I've mentioned that they contain both estrogen and progesterone. The people that are allowed to use this, those who should not use the combined oral contraceptives are we have breastfeeding mothers before 6 months postpartum. Postpartum is just a period where the woman has already given birth, yeah? So breastfeeding mothers are not really advised to use this method, basically because it has an effect on milk production and the quantity of milk that is being produced. So please, if you're a breastfeeding mother, do not use the combined oral contraceptive. And then we have pregnancy or suspected pregnancy. Also, you should not use this method because, as I've mentioned, these hormones are normally used in the works of pregnancy, so it can basically affect your pregnancy period. Women with unexplained or suspicious bleeding, if you're having a lot of vaginal bleeding, mostly you're not really, this method is not really recommended for you. Women with a history of blood clotting disorders also, you're not really allowed to use these methods, and I'm sure you'll be given more information once you visit a healthcare faculty. So when you are supposed to use this method, or rather when you should start using this method, you can start using this method within 5 days after the start of your menstrual flow. Like your flow has started today, you can count 5 days and then uanze kutumia your method on the 6th day. Any other time that you're sure you're not pregnant as a woman, if you're 100% sure you're not pregnant as a woman, you can also start using the COCs. If you are more than 6 months postpartum and your menses have resumed, remember that the menses normally stop when one is pregnant. So if it is like you're 6 months postpartum, you've already given birth and your menses have resumed, then you're allowed to use the COCs. If you are switching from one hormonal method to another, you're also allowed to use this COCs. And if you're also switching from one non-hormonal method to another, you can also start using the COCs. I think I should also mention the instructions for use. You can take one pill each. Preferred time is basically each time at the same time every day. For example, if you're taking it at 3 p.m. today, you should also take it at 3 p.m. the next day, 3 p.m. If anything occurs within 30 minutes of taking one pill, you can take another one. Yani umechukua pill sahi ukatapika, maybe the taste wasn't really that favorable for you. You vomit. If it occurs like 30 minutes, umechukua sahi 30 minutes zikapita, you can take another one. If one pill is missed, umemiss leo, you have to take another one to supplement it. If 2 or more are missed, then you have to follow instructions that are utakuwa umepatiwa huko hosi. But then you should use a backup method for 7 days if you're sexually active during that period. Okay. So kuna side effects milioni. Kuna abdominal pains. When you're using this contraceptive method, there are abdominal pains. Chest pains sometimes. We have a bit of headaches, eye problems, and severe leg pain. And if you're experiencing any of these side effects, then you should stop the intake of the COC immediately. Okay. Yeah, that's all I have to say about COC.
Okay, wow. I hope mmelearn a lot hapo.
Yeah.
Pia kuna things I was googling out, and nikapata pia kuna patches and vaginal rings. Basically, I don't even know what they are, but I hope ukienda hosi utaelezewa even more about them. So we're going to go to the next one, zenye ni IUDs. I love the idea of IUDs because they take a very long time ukizitumia, like, and you don't have to really worry about them. So we're just going to discuss what they are. According to Kadiasa, they are not called IUDs. Again, mambo ya hospitali na mambo zao zinaitwa IUCDs. Zinaitwa IUCDs. Me, I call them IUDs because, like, I think everyone does call them IUDs, but according to nini inaitwa je madaktari, it's IUCDs. So if she says that, please muelewe. So yeah, we're just going to, like, get into it. Acha ileze.
So IUCD, in layman's language, IUD, nobody's judging you, Cecilia, for calling them IUDs. But I'm finna stick to IUCD because that's what I've been taught. So this is just basically a small plastic device that is inserted into the uterine cavity to prevent pregnancy. And how it works, it decreases the number of viable sperms that reaches the oviduct. It prevents fertilization. Of course, if you decrease the number of viable sperms reaching the oviduct, it means that fertilization will be prevented. By interfering with sperm motility, as we all know, sperms are supposed to swim all the way up to the oviduct in order to fertilize.
Then boom, baby.
I know, then boom, sperms are swimmers, you know. So once it interferes with that sperm motility, the movement and everything, fertilization is prevented, and that is exactly how it works. Of course, there are also hormonal IUCDs. This ones work specially by releasing progesterone, and progesterone is a hormone, as I've mentioned earlier. It releases the thickness of the cervical mucus. Any cervical mucus is released, suppressing ovulation in some cycles, and it also thins the endometrial lining of the uterus. I hope that you're relating to these things because, guys, I don't know if I have time to explain everything or endometrium nini, but for more information, of course, you can visit a hospital or health care center. So we have different types of IUCDs. There's the copper IUCD that is commonly known to mostly everyone. We have the Nova, we have the multi-load. The types go on and on and on and on. And we have some contraindications that are used. I mean, the contraindications that are present that one should take care of, you know, during the use of this IUCD. Kuna prolonged labor. If you're in labor and it's prolonged, it's a contraindication. Kuna prolonged membrane rupture. We also have infection of the genitals. I think these things should be mentioned to you once you visit a healthcare center. And we have the people that can use it. Basically, anyone can use the IUCD, any woman, of course, because it's working for women. It's the uterine cavity. But you should follow up with people who have who are second trimester abortion. Ume abort second trimester. God, I really hope you understand these things. People.
What is that?
Google, guys. Google. Yeah, women with endometriosis, it's a condition. Women who are younger than 18, women with history of DVT, null parity. Goodness, if I start explaining everything here, tutachukua 3 hours kumaliza. So let me just jump straight to the danger signs that one should take care of, or rather beware of when you're using the IUCD. We have perforation, we have pain. If you're experiencing any pain during the use, when you're using the IUCD, you should be very careful. Vaginal bleeding, hypovolemic shock. We have sepsis, endotoxic shock, rigors. Oh my God, all these things are just so complicated. This just sounds so complicated. They're really simple things. Stress, you can just Usijali, this is not cancer we are talking about. These are just simple things, yani mtaelewa tu. And then of course we have the advantages and the disadvantages of using the IUD. Let me go back to the layman's language. The advantages, it is highly effective. It is very, very effective. It offers immediate protection from pregnancy, of course. Ukishaiweka tu hivi inaanza kuwork immediately. It does not interfere with sexual intercourse. Utakuwa na ile strain ya anga. I think it's when it comes to condoms, they're a bit I don't know if they're a bit uncomfortable during sex. I don't know. For those who know, mnaweza niambia. I have no idea. Okay. If okay, it does not interfere with the breastfeeding. And of course, ukisha insert, there is no further cost after insertion. So ukishaeka ni hivyo, you just enjoy life bila kujali finances after the insertion. Okay. And then kuna disadvantages. Of course, the biggest one is it does not protect one from the STIs. Ina prevent to pregnancy, basically. Okay. Kuna translocation and expellation. If you mess up, inaweza toka, yani it can be expelled, from the uterine cavity. We have uterine perforation, and of course the insertion and removal. It needs a trained service provider. Yani siwezi kuwa nimekutana tu na siku moja na niamue acha nikuweke IUD kivipi. You need someone who's trained. So those are the disadvantages, but generally I'd say that IUCD is actually like very effective, and most women should advocate for its use.
See guys, kwanza she agrees with me 100%. Like IUDs got you. Even though mimi nitasema that's my opinion. For another person anaweza kuwa like no. But that's my opinion. Kitu ingine I've just remembered before I forget. There is this thing, it's on Netflix. You should watch it. Watch kama you need more information into a Sex Explained. If you go there, those people like in that it's a whole episode. I don't know of kitu 6 episodes or something. They explain everything about sex nini kusu inaitwaje kusu the types of contraceptives there are vitu kama hizo zote. So you should definitely check that out. And then we're going to go to the last thing, permanent methods.
Oh my god. So these are basically just procedures that provide permanent contraception. They are male and female alike. And they are supposed to be absolutely voluntary. No one is forcing you, hopefully. So there are we're finna start with the female voluntary, also known as tubuligation. Oh, Jesus Christ. It is a minor surgical operation, basically just involving the cutting and the tying of the fallopian tube to prevent the sperm from fertilizing the ovum. So it has an effectiveness of 99%, which means it is very effective, but only about 3.2% of the women normally undergo this tubal litigation. Oh my god, I am saying my own things. Let's just say female voluntary surgical contraception. Hivyo ndio nitaita. So kuna advantages ni mingi. It is very effective and safe. It is very highly effective. That's what tumeweka ya mwisho actually. It is permanent. This you won't have to worry about getting condoms and everything after this. Getting any other method of contraception. It is permanent, so it's good for those who have decided to undergo the procedure. It has absolutely no effect on breastfeeding. So if you're a breastfeeding, lactating mother, you are very safe in using this method. It does not interfere with women's sexual performance. So you can give your best during sex. Excuse me, it does not interfere with anything. So skills zako zitabaki kuwa zako during this procedure. After this procedure, it is very cost effective. It's not really that expensive, and there are no significant long-term side effects. So side effects ni kidogo sana. So that's why the advantages are ziko kwa wingi sana. Kuna disadvantages. Of course, it does not protect one from STIs, sadly. It is irreversible. So if you go through the procedure and then you're like, oh my god, I think I want one more child. Sorry, it's kind of irreversible The procedure, of course, requires an expert and an equipped faculty. You just can't start cutting someone's oviduct inexperienced. You have to have a lot of experience, yeah. And of course, yeah, I think that's it. The disadvantages you may have. So there are more advantages than disadvantages, of course. But there are some risks that are associated. Kuna post-surgical procedure pain. Lazima utasikia uchungu kiasi after the procedure. And in very rare cases, I repeat, very extreme cases that are rare, extremely rare cases, pregnancy. You might just end up getting pregnant after this procedure. But there are very rare cases that have been mentioned. So we can just say generally it's safe. Yeah. Shall I go on to the male? Yeah. Male voluntary surgical contraception. Just vasectomy, basically, yeah. So this is a surgical procedure of cutting and tying the vas deferens to prevent spermatozoa from mixing with seminal fluid, consequently when ejaculation occurs. So, hey, Yamani, how will I explain what the vas deferens is and everything? You just know it's effective. Okay, so basically the method of action, the mechanism of action is prevention of sperm movement from the testis to the seminal vesicle and the urethra, preventing fertilization. So hapa tuna prevent sperm motility, yani. And it has an effectiveness of 99.8%. So that's actually really good. The advantages, it is highly effective, of course, and very safe. It does not interfere with sex. So kama kawa skills zitabaki zako. It is considered permanent, so you don't have to like worry about any other contraceptive methods involved when you've already undergone this procedure. It is less effective and very easy to perform. Yeah, so those are some of the advantages. We have disadvantages. Let me think. It is irreversible. Yes, it is very much irreversible. Like once you've gone through it, there's no going back. And of course, only a skilled provider can perform the method. It does not protect against STIs, sadly. And there is a slight delay in effectiveness, but eventually itakuja kwa effective baadaye. So, men that should not have the procedure, like if you're a man and you're thinking vasectomy, you have these two feelings. One, a client who is uncertain about their future. You're not really sure if maybe the amount of kids you have right now are enough, or kama ulikuwa umejiambia you don't want to get kids, then you're thinking, maybe in the future I'd want to have kids. You shouldn't undergo the procedure. It's as I've said, it's permanent and irreversible. So it's something that you want to think through before you do. And a client who cannot stand surgery, if you feel like surgery is too much for you, please do not undergo this procedure. But all in all, a backup method should be used to ensure effectiveness is 100%. Yeah.
Wow. And I cannot believe that we're done. Kitu nitasema ni first of all, if you're willing to have sex, please be responsible of yourself. Usigoje your partner like akwe responsible for you, because what if your partner is not who you think they are? Na ujikute wakati you are pregnant, uko hapo unateseka peke yako. What if, because zero judgment, what if you're just you're in your whole phase? You definitely need to take care of yourself. So do consider these options, please. Take care of yourself. Let's try as much as possible to reduce the rate of abortions, because I can imagine the psychological torture it's going to like affect you or affect the people around you. So please do take care of yourself and do take this into consideration. I understand that it might be hard, especially financially, but try to save up. Hata kama you're not going to save up much, try to save up. If you have a loving person, loving partner, also mwambie you can save up pamoja and go for the method or for the types of contraceptive options. They are there. Some people have very supportive parents. If your parent is supportive, I am sure atakubali kukupeleka. If not, mama, nini inaitwaje, Charlie, out there, you got yourself, you need to take care of yourself all the same. If you're willing to go out and party na wazazi wako wasijue, you can also do this for yourself. So do take care of yourselves, protect yourself, take care of yourself, love you, and this is one of the ways to do that for yourself. So that's all for today. Please subscribe, love, and nini inaitwaje, tell us more you'd want on the episodes, and we'll try our best to tailor it to your experience. Have a lovely day, have a lovely week. I'll see you next week.